Hello everyone, welcome at SudhirEyeCoach, a channel for emerging and budding ophthalmologists. I am Dr. Sudhir Srivastava, Cataract and Refractive Surgeon, Head of Sanai Group of Eye Hospitals at Lucknow. Today I will be showcasing a case of posterior subcapsular cataract with grade 2 cataract. Such type of cataracts we often get in young age where the nucleus is not very dense but the posterior capsule has a dense plaque of a layer of fibers adherent with the posterior capsule. Because the glow is good, to perform phacoemulsification and to perform rhexis not very difficult. Phacofragmentation is often very easy because nucleus is not very hard and it's very easy to crack and absorb and clear. However, we often get plaque which is adherent with the posterior capsule and it is very difficult sometimes to remove. So there are so many techniques to polish the posterior capsule. Obviously we can use the IA tip to polish the posterior capsule where we use low vacuum, and in this particular case I'll showcase that how I used IA to remove the posterior capsular cells and the fibers. But few of the fibers are very difficult to remove, and I often use a hydrojet technique to polish the posterior capsule, where I push the PSS parallel to the posterior capsule with the angled beveled up cannula, and in majority of the cases it is very easy to remove the loose fibers and cells present on the posterior capsule, and if you go towards the equator you can remove the equatorial cells also. So watch this video carefully, and if you have any comment, please comment so that we can have a decent connect or can note it down in the comment box. And if you have not subscribed my channel, then please subscribe it. That will give another boost to my energy to create such videos. Thanks for watching.